My name's Emma Baker. I'm a Professor of Clinical Pharmacology and consultant at St George's, University of London and St George's Hospital. As a clinical pharmacologist, I have multiple roles relating to making sure that patients get the best medicines. In clinical practice, I look after patients with multi-morbidity and polypharmacy and work with my pharmacy colleagues in delivering medicines management, making sure that we have the most effective and safe medicines for use in our hospital and across our region. In research, I work in clinical trials, and I also have a huge role in education, developing the healthcare professionals of the future and teaching them to prescribe, and in also teaching the researchers of the future, teaching them to be clinical pharmacologists who can work in drug development. The COVID pandemic has been a time when we can see how important clinical pharmacology is to the NHS. In my trust, I've been contributing to our clinical trials decision group, making sure that we choose the right trials for our hospital and that we can deliver them. I've also been involved in writing national guidelines for GPs and clinical pharmacists about sick day rules for usual medicines, pulling together the guidance around COVID-19 across all specialties so that GPs can have them in one place and can have simple and pragmatic guidance on what to say to their patients. And this is really important to make sure patients have good control of their long-term conditions, but also that they avoid potential harm if they become acutely unwell. It's been a really big time for education, and as part of my job is teaching healthcare professionals and scientists, it's been about making sure that we get great education online so that our students don't lose out and we don't lose the opportunity to develop these people for the future. The COVID pandemic has taught us that there's so many ways that clinical pharmacology is important to the NHS. So how can we take this forward to contribute to future healthcare? In clinical trials, it seems essential that clinical pharmacologists are involved in the design of these to make sure that someone is really focusing on getting the right population, the right dose and the right outcome measures, so that these trials, even when done in a rush, really give us the answer to the questions that we're asking. In clinical practice, the clinical pharmacologist as a specialist generalist is really important in making sure that patients get the best medicines. And new ways of working will mean that we perhaps are needed to pull together guidance, for example, for our GP colleagues around the use of medicines. And then in education, we've learnt so many things so quickly about delivering education online. For example, last week I gave a webinar around the use of medicines to 200 GPs, and the opportunity to access more people, but also people out there are changing their roles, means that clinical pharmacologists are going to be more important than ever in making sure that people are prescribing the right medicines.